Today we're going to demonstrate our technique. This is a more complex meniscus repair in a young patient with a bucket handle tear, in addition to a horizontal component to the capsular portion of the tear. You can see here this bucket handle tear has been reduced now. We are cleaning the tear pattern and making sure we've got adequate debridement for the repair. You can see that the tear is reducible, and we place a cannula to prevent any catching of the sutures or a suture bridge. Here we're doing a Arthrex fiber stitch into the root area to reduce the meniscus back. This will give us our initial fixation and prevent the meniscus from continuing to bucket. This is nice because it has two limbs for more thorough fixation and better biomechanical strength and pull out. After this, we're going to turn our attention towards the inside out repair. Again, these are suture tape needles, and we're going to place multiple into the meniscus fragment in vertical mattress fashion. This is the highest biomechanical strength, and you can already see that we're getting excellent compression of the meniscus back to the capsular tear. We're going to place multiple in the periphery using different guide systems. Here we have it well reduced, but now you can see the horizontal component, so we're going to require us to use a different device, and we want to get underneath both leaflets. We're going to pass this through. Again, this device works excellent for situations where we have to do both a horizontal repair or an additional vertical repair. You can see past it, this is an O suture, and then we're going to do sequential half hitches, keeping the knots underneath the meniscus. And this compresses down the entire fragment. Following this, replace this a second time as this horizontal component went through the entire posterior horn. Again, the trick here is to make sure that you get the passing portion of the system underneath the meniscus. And then we are coming out, and again, the nice thing about this is the contour and the needle does not hit the condyle. And now we'll do another round of alternating half hitches to compress this fragment back together and repair both the vertical and horizontal mattress components. Here you can see sequential half hitches. We're really compressing this meniscus back together with the hopes of potentially healing. We're going to cut this, and then we're going to replace one more vertical mattress suture. We placed a few inferiorly as well, and this is going to compress the entire fragment. Again, in this case, given the challenge of this fragment, inside out was chosen and would allow us to put more sutures in as well. You can see we have inferior fixation as well. Now we've tied this off with the leg and extension. You can see we've compressed the meniscus back. There's no further mobility, and it is well compressed back to the capsular fragment. Both the horizontal and vertical component have been repaired. Then we're going to turn attention to microfracturing the notch, which has shown in a number of studies to increase the healing potential, essentially simulating an ACL tear and bringing in stem cells. Thank you.